This is my office, Middle Georgia Chiropractic, and I'll give you a quick tour. Our patient reception area, front desk, in the front desk area and insurance, x-ray in the back, examination room, and we've got 2 treatment rooms in our office, and they're both similar. And I'm going to go ahead and show you a demonstration of an adjustment in this room, and we're going to use our patient Matthew here to help us. Let me set this up. Alright, now when a patient comes into an office, if we were going to see somebody for a neck complaint, probably on each visit, even if they're an existing patient, we may do some preliminary workup, check range of motion, possibly reflexes. To do range of motion, we might take the patient and take their neck area through all the planes of motion, rotation, lateral bending. And we're looking for fixations or areas that aren't moving appropriately. So if we find an area that's not moving appropriately, that's going to be the area that we're going to look at and target. We may want to do a few orthopedic tests, such as a cervical compression testing, and ask the patient if that produces pain. We might do a shoulder depressor test, and again ask for pain response. We're looking for soft tissue irritation at that point. We may do reflexes, which some of you may have been taught. For a neck complaint, we might want to look at reflexes on the upper extremity to make sure that we've got neurological input to those muscle groups. So we may do a bicep reflex. Just relax it right there. And bend it. Just let it relax. Just let it relax again. We may do other neurological exams as necessary, but basically when a patient comes in that we're already seeing, we may go ahead and get them on a table pretty quickly and go through our scan protocol for the adjusting instrument, and that's what I'm going to show you right now. So we'll go ahead and have you go ahead and get on the table. And these tables were designed to make it easier for the patient. There you go. To go ahead and get on and off. We see a lot of patients with back pain that have trouble climbing on and off a table. So this is really nice. It allows us to take the patient down in a neutral position so that when we do our examination in this prone position, we can determine pelvic imbalance, leg length inequality. That's going to give us some clues as to treatment of the back or the neck, and I'll go ahead and show you from here. So we're going to take the patient all the way down, and we're going to unlock the foot plate, and as the patient remains in that position, we're going to check leg length differences and look for any imbalance in the pelvis. I'm going to bend the legs a little bit. All right. And what we're finding, this patient has a short right leg pattern, which gives us some kind of indication that we've got pelvic rotation through the sacroiliac. So that's an important finding for a chiropractor because the pelvic rotation determines what happens with the rest of the spine. So if we have pelvic imbalance or rotation, it's going to create more strain to the back joints, and it's going to change that patient's posture all the way up. So in chiropractic, instead of just treating a symptom, if somebody comes in with back pain, and saying, okay, I can give you something for back pain, say a pain pill, a muscle relaxer, and send them on their way. We want to get to the root cause of the back pain. So if we've got a biomechanical problem in here, some kind of challenge, we want to correct that as much as possible, let the body reset itself, and start letting those joints function again. So since he's got pelvic rotation, we're going to start with the instrument, like I showed you in the last film. So this instrument has a soft tip. It's got a computer inside that's going to determine motion. It's going to give us multiple thrusts. We're going to use these on different parts of the joint here. So in this case, we're going to start with the pelvis, and we've got 3 areas. And we're going to get the other side, the other sacroiliac joint. Now if you notice, that side gave us 2 beeps, so we've got some loss of motion in that sacroiliac joint, and that's not going to allow proper mechanics for this pelvis. So we've got to get more motion on that right sacroiliac side so that this pelvis can function better. And in this case, this patient's a cross-country runner, so pelvic function and low back function is going to be very important. If we have some kind of imbalance in an athlete, they're not going to function as well as they should. So we're going to try and get a little bit more motion on this right sacroiliac joint. Okay, now you hear the one beep, so we've got motion. We'll go just a little bit more. Okay, so we cleared that out. So now we've got movement in both sides of that sacroiliac joint. So again, we're working on these joints. If you look at the spine here, these two big sacroiliac joints, which give us on each side here our walking motion, our stepping motion, getting up and down out of a chair. So it's very important to have normal motion on both sides so that this pelvis and back can work appropriately. If one side's fixated and not moving appropriately, then it's going to change all the mechanics in the spine. So from a chiropractic standpoint, we want to look at that whole person and make sure that we get the body working as close to normal as possible, and the body can reset itself and start healing. So now for today's sake, I'm going to go ahead and skip on up through the neck area because it might take a little bit of time. But to show you on a close-up here, what we're trying to do with this instrument is, this is a spinal segment. So we've got the two joints, one on each side, the spinal joints that come together. We've got the neural foramen, or the IVF here. This is where the nerve root, the spinal nerve root comes out. But this is where we do most of our work, making sure that we restore normal function and movement to that facet joint in the spine, and then the effects of that joint not working can transmit to that nerve root and cause problems. So this is really where a chiropractor focuses. So we want to restore normal motion, reduce irritation and swelling around that joint, which in turn will benefit that spinal nerve root and then any organ system from that point on. So that's our big focus. But you can see how nice it is for the instrument to get in here and lets us be very specific on that segment and move those joints. And these things only move millimeters. They don't move inches. So we'll go ahead and scan on up through his spine here now. All right, so we're going to use, not only do we do muscle testing to determine where to adjust, we're actually going to use palpation, where we're putting hands on the spine, or palpation with our fingertips, but we're looking for segments that aren't moving appropriately. So right off the bat, I can feel an area right in here where we've got an abnormal muscle tone, and if I palpate, we've got more muscle tension along this left side. So I know there's some kind of dysfunction at that segment, that joint's not moving appropriately, and it's causing a muscle imbalance from one side to the other. So that's our objective finding. The patient may notice it's a little tender. When we scan up along through there, they'll probably feel that spinous process be a little bit more tender. So we're going to start right there. See if we can clear that one out. Okay, that cleared pretty easy. We're going to go right on up through there. Okay, we got good movement on all those segments. We're going to move right on up. There's another one right there. Now on students and people that sit at computers all day, people that carry backpacks all day, tall patients like Matthew here, we see a lot of dysfunction through this mid part of the back. And like we talked about earlier, text neck condition, where the head is bent down into flexion, working on phones or laptops all day. That strains these muscle groups all the way back through here and creates a lot of neck issues for us. So this junction up here is really important, and we try and educate our patients on proper use of the phone, of computers, and some stretches that will help remedy that issue. We're going to go right through here again. And again, he's got fixation right up at the top here. So this is very comfortable for the patient. Again, it's well within what these joints should tolerate. There we go. All right, now we're going to do a couple muscle tests for the neck that are very specific to certain joints. So I'm going to have him shrug his shoulders up a little bit. Go ahead and shrug, and then back down. Now lift your head upward a little bit, and back down. All right, now that tested C5, C6 when he brought that head into extension, and that shortened up the leg length here. So I was able to see a change. What happens with that is when we stress a joint along the spine with a very specific movement, if there's irritation in that joint or dysfunction, some kind of stimulus, it'll create a reflex effect on some of these big paraspinal muscles that hook onto the pelvis here. And for just a few seconds, when those things contract, we'll see a change in leg length. That's a clue for me that I know we've got something wrong in here. So And then we need to address that C5-6 area. Again, we're going to get right up there. All right, we cleared that one easy. Tuck the chin down just a little bit. This is checking the upper cervical spine. And again, he shortens up on this side. We're going to bend the legs a little bit, and it stays short. So in position 2, that helps you can go ahead and let your neck relax. That lets me know that we've got rotation along this left side here. And we're going to go up and palpate. And usually you'll find some tight fibers along with that. It might be a little tender to the patient. So we're going to clear that one out as well. There we go, that was easy. All right, so we should have a nice reflex change back here and come back to even, which it does. So basically, and we would check a lot of other things on an average patient visit, but we cleared out the pelvis. We found quite a bit of dysfunction throughout the thoracic spine. Some key areas, the C5-6 in the neck, which is one of the main work areas of the neck, and that upper cervical area. So we talked about problems with infants such as colic and ear infections, ear ache. We get a lot of fluid buildup in the inner ear in infants. That's an area that we always want to check as well. But like for our senior patients, we talked about sciatica, degenerative changes. We're going to see a lot of that issue down here. We see a lot of patients that have already had back surgeries. They may have fusions in the lumbar spine with hardware, but we can still safely treat those patients since we use an instrument, and we can work above and below those fusions area very safely. And there's just, using the instrument gives us a wide treatment option for these patients. In the old days when we did, the single contact or the hard thrusting on a patient, there were some patients that couldn't tolerate that kind of treatment, somebody with osteoporosis or other kinds of issues. But we can use the instrument, safely get into that facet joint, put that movement back in there, all within a comfortable tolerance for the patient, and it's very safe and effective. So, but that concludes a typical adjustment in our office. If this patient was in a lot of muscle spasm, we may use a type of therapy like an interferential unit, where we would put some pads on the patient. The interferential therapy would help address the muscle issues, the soft tissue complaints, pain, swelling, muscle spasm, and that would help speed things up. But the adjustment would be the most important part, restoring motion back to that segment. So that'll conclude today's tape, and I hope if any of you thought about coming to a chiropractor, you might be a little less fearful now. It's safe, effective, and we can get you back to work faster. Thank you.